On this week's show,
this was why you chose medicine. This is your calling.
We are delivering 795 meals every day.
Social distancing is the most powerful tool that we have currently.
Have you read to hold your breath for 10 seconds as a self-check to see if you have COVID-19?
So there's this popular saying that goes, the stock market is not the economy, but rarely has that ever been more true. So clearly there is a disconnect. So what gives?
If you want to do exercise, you can't go outside. If you want to walk your dog, no.
Hi everyone, I'm Jennifer in New York.
And I'm Kurumi in Tokyo.
It's April 17th, 2020.
And this is Quick Takes wrap of the pandemic this week.
New York doctors are about to get some extra help as thousands of medical students graduate early this week. We spoke with a few medical students about how they're feeling as they head to the front lines throughout the Northeast.
People really need doctors. Patients really need us.
It's time to step up to the plate. That time is now.
This is an unprecedented time in medicine in the last 100 years.
You hear stories about young physicians and nurses getting sick and critically ill and even dying. So it's easy to sort of watch what's going on and get tremendously depressed and scared. There's sort of that selfish, primitive portion of the brain that says, I just kind of want to curl up in a ball and not go out and do this. And then that rational side kicks in and reminds you that this was why you chose medicine. This is your calling. The time is now.
I am asking healthcare professionals across the country, if you don't have a healthcare crisis in your community, please come help us in New York now.
NYU announced that it was graduating their class early. Of course, New York City is about 2 weeks ahead of us. We would anticipate that we would be peaking in April, just about the time that these students would be graduating, and therefore we may very well need their services as quickly as possible. During World War II, several medical school classes graduated in fewer than 4 years. And for the same public health reasons, the government wanted to get physicians to take care of the troops earlier.
Won't you join the American Red Cross and become one of these merciful workers?
The soldiers in this fight are our healthcare professionals.
To hear like the governor and especially to hear our dean say like, you're ready and we need you is a real representation of how serious things are. If there wasn't such a lack of PPE, there wouldn't be the need to call in all these people early. If we were able to protect the current providers as best as we normally can, then doctors and nurses wouldn't be getting sick, then they wouldn't be out of work, and then we wouldn't really probably be needing to bring in all these people early.
Sometimes when I'm sitting here and trying to focus on my schoolwork, sometimes it makes me a little upset because I'd kind of like to be there too. And if they let us sign a waiver right now to allow us to help out in hospitals, I think a lot of us would. I know I would.
In Australia, a group of Sikh volunteers are hard at work feeding the elderly, the disabled, and the isolated. Here's what their day looks like.
We are delivering 795 meals every day for the people who are affected with the virus directly or indirectly. Sikh volunteers started in 2014 to help people with food and with the volunteer services. We are getting so many calls from people who lost their jobs, elderly people, people are homeless, international students, single moms. Every day and every week we got a different menu, so people can choose according to their taste. We got special requirement by the people, like they got allergic from the gluten, from the mushroom, then we make a special dish for them. We have to keep the safety of all our volunteers as well. We are following all the instructions, social distancing and other things. It's a bit hard for us, but we still, all the volunteers doing the hard work to prepare the 800 meals. I drive the people with a disability, but I lost the job, so I'm giving my time for this volunteer services. Most of the volunteers lost their jobs because of this virus. We want to give back to the community. We have so many Sikh organizations in different parts of Australia doing similar work to Sikh volunteers. Love all, share all.
It's no secret that everyone around the world wants to get back to some sort of normal, whatever that even means today. But health officials are saying it's not just going to be a flick of a switch and we're back to the way things were. In fact, this week, a group of Harvard researchers said we may need to practice some level of social distancing until 2022. So before we talk to you about this Harvard study, we had a viewer question after our conversation last week about immunity. So Daniel wants to know, could we first develop a method of purposefully infecting a low-risk population with a low virus load and then use those antibodies to suppress the infection, thus getting more people with immunity ready for the workforce? Like, what do we know about immunity at this point?
You know, one of the things we talk about with vaccines and exposing healthy people is that you really want a almost perfect safety record going into these sort of things, because when you're treating healthy people with a product, a medical product, be it a vaccine, a preventive drug, or what your viewer's talking about, you don't want to make anything worse. The last thing you would want to do is take someone who isn't sick and make them sick, because then you expose them to a lot of risk.
All right, so thank you, Daniel, for that question. So let's move on to this Harvard study, which said intermittent social distancing may be needed until 2022. Please tell me that's a worst case scenario. Like, what are we actually looking at here? What are they talking about?
Yeah, I think one of the things that, that this study reflects is that we're probably going to have some changes in behavior that go on for a period of time. I think what that study is an acknowledgement of, though, is that we don't have this under control. Social distancing is the most powerful tool that we have currently, and that until this outbreak gets pushed back out of the human population or controlled to a level where we can do really effective testing and tracking and tracing, you're having to do these big, blunt measures like social distancing until you have some of those things fixed.
This week, we also saw several government leaders and agencies sort of taking their reopening strategies into their own hands. We had FEMA and the CDC come out with their own plans, the cluster of governors. Is that what people should expect is the new normal? Like, we're not just going to flip the switch back to the way things were.
Yeah, that's exactly right. There is going to be no, hey, flip the switch and everything's back. And I think it's important to realize that even if the governments and public health authorities said, hey, everything's back to normal, people's behavior still matters. There's still going to be a lot of caution in consumer behavior and socializing behavior for a while because this has rattled people. When you look at a lot of the plans, all of them have some kind of phased step up in activity. And it basically says we need to figure out which areas are low risk, which areas are medium risk, which areas are high risk, and target the measures we need in terms of lifting these restrictions and how closely we need to track outbreaks and keep an eye on things in those places. So it's going to be a stepped and long process, unfortunately, instead of, flip the switch and the lights are back on and it's all back to normal.
Misinformation about the coronavirus has been spreading all over the internet. So we asked Bloomberg's Sarah Ponczek how exactly we can spot it on our own social feeds.
During the coronavirus pandemic, disinformation has exploded on social media. Have you read To Hold Your Breath for 10 Seconds as a self-check to see if you have COVID-19? How about drinking diluted bleach as a treatment or even a cure? Problem is, it's not true and potentially dangerous. Big Tech has ramped up its efforts to stop the spread of fake news. Facebook prominently displays COVID-19 information, giving users easy access to trusted sources like the WHO. WhatsApp also launched a similar page for healthcare workers, educators, and local governments, giving tips on how best to communicate using that platform. Twitter's removing tweets that recommend cures or advice counter to those of public health authorities, and YouTube has demonetized some coronavirus content. But ultimately, it may be up to you to be your own disinformation detective. So, here are some tips that you can use to spot coronavirus misinformation in your social media feed. First, ask yourself, is the content more surprising, inflammatory, or politically one-sided than you'd otherwise expect? Is the post urging you to share it? Are there blatant misspellings or poor grammar, and does someone stand to profit from the message? If you answered yes, it might warrant a second look. And that means checking to see if the handle is verified by the platform. For pictures, do a reverse image search to see if any of the photos originated prior to the COVID crisis, or go to the verified handle or page of any authority cited. Remember that breath test? Depending upon the version you read, it may have cited Stanford University. And if you were to check their Twitter page, you'll see it debunked right there, specifically calling out the content as misinformation.
I'm Sarah Ponczek, and I am a markets reporter with Bloomberg News. So there's this popular saying that goes, the stock market is not the economy, but rarely has that ever been more true. Think about the economy right now. It is clear that we are in a recession. Calls for a jobless rate above 20% are looking more realistic. A measure of retail sales this past week fell the most on record, and the International Monetary Fund put out an outlook saying that the Great Lockdown Recession, that's what they're calling it, they said it will likely be the worst since the Great Depression in the 1930s. Now, meanwhile, the S&P 500, the stock market, since March 23rd, the 15 days that followed, we saw a 27% rally. That's a forcefulness that we haven't seen since 1933. So clearly there is a disconnect. Well, as we have discussed before, the bears, the pessimists will say that we are still in a bear market, a market that is still trending lower, and this is just a bounce that will eventually reverse itself. Your optimists, your bulls point to unprecedented amounts and speed as it relates to fiscal and monetary stimulus. They also point to the coronavirus curve, saying that it's flattening, and also the predictive nature of the stock market. Now, what I mean by that is typically history would show that the stock market bottoms 5 months before the end of a recession. So say that March 23rd was the actual bottom. You do the math 5 months out, that would place us at late August for the recession to end. However, a lot has to go right. The coronavirus curve has to continue to flatten. Economies need to reopen successfully. Businesses need to get back to it, and there cannot be a second wave of the virus. At the same time, though, there is another way to explain the rally that we have seen, and a lot of it does have to do with the makeup of the stock market, the makeup of the benchmark. So think of the S&P 500, for example. the way that it's structured is by market cap. So your biggest companies like Apple, Amazon, Facebook, Google parent Alphabet, Microsoft, they all have more clout, more influence on where the benchmark goes because they have a heavier weighting. Amazon is seeing demand for its e-commerce business. Amazon hit a record high this past week. Netflix too did hit a record high this past week. So as we see some of these large mega cap companies, their services actually seeing more demand because of the circumstances we are dealing with, that does help pull the market higher too. So many scenarios flying about out there, and whether or not we are truly in a bull market right now, still very much up for debate.
Imagine having to apply for a permit every time you leave the house. Well, that's the reality right now in Dubai. Sylvia takes us on her grocery run.
I need to go grocery shopping, and to do that now in Dubai, you need to apply for an electronic move permit online. This is what you need to leave the house now. So now I'm just going to go on the website. And you can use this for doing essential shopping, to go to the doctor, or to go and get medical supplies. So we go for next. I'm going to use my national ID here, which is linked up to my mobile phone. I have to select my transport type. I'm going to go by car. And I need to put in some other data like the date and the time I want to go. I hit apply. Request is now pending with the Dubai police. So I've got my permitting. It took 5 minutes to come through on my phone. I can leave the house in 15 minutes time to go shopping. If I went out without this permit, I could be liable for a fine of around $600. Now it's mandatory when you go outside to wear a mask and some gloves. Now that my car is registered on the permit system, it means that I can drive through the police checkpoints and I won't get a fine if I go through a radar. It limits the amount of people that can go outside during the outbreak because there's now a 24-hour curfew in place. And you're just meant to have one family member going, and you shouldn't bring your children. If you want to do exercise, you can't go outside. If you want to walk your dog, no. One man called a local radio station the other day and asked if he could apply for a move permit so that he could see his second wife, and the police said no. So it's quite limited what you can use it for.
All right, that wraps things up for us this week, but you can still get all of your coronavirus news from Quick Take 24/7 on Twitter, Facebook, Instagram, and YouTube.
And for a daily recap of the day's top stories, subscribe to our newsletter. Thanks for watching. We'll see you next week.